chronic obstructive pulmonary disease. And what's happening is it's a damage to the lining of the airways. This causes an airflow issue. So patients with COPD can breathe air in just fine, but because of that damage and less elastic airways, breathing out is more challenging. And it can progress over time, particularly if they continue to be exposed to whatever was causing it in the first place. So it's a pretty common disease. There's about 11 million people currently diagnosed in the United States. That's close to 4% of the population. It's also a very prominent disease globally. It's one of the leading causes of death in the world. The people who are most commonly impacted are people who have been exposed to something that is damaging that lining. In the US, the most common risk factor is smoking, particularly cigarettes. More globally, things like biomass fuels and cooking fires tend to be contributing. Now, there are, of course, any air pollutants, so like air pollution, or if you're around secondhand smoke, things like that can also cause damage. COPD sometimes can be missed because it could be attributed to things like a smoker's cough. So the common symptoms in COPD are shortness of breath, cough, and mucus production. Now, some people think I just haven't been exercising and I'm out of shape and that's why I'm short of breath. Some people think, oh, you know, everybody who smokes has a slight cough and a little bit of mucus production. So sometimes these symptoms can be attributed to other things when really it's the start of COPD. So the most common gene that can cause a hereditary COPD, even in patients who don't smoke, it's called alpha-1 antitrypsin deficiency. Anybody with COPD should be screened for that. Also, there has been found to be a link, so in families that have a lot of members who have COPD, other members are more likely to have COPD, but it is a little unclear at this time whether that's purely genetic or if it's because of shared environments. So things like secondhand smoke as well as air pollution can also contribute. A lot of things can give you hints that maybe COPD is happening. We talked about some of the symptoms, so getting a medical history is important. Physical exam, I'm listening to their lungs for wheezing. All of this is giving me information, but the true diagnosis comes from pulmonary function testing, in particular spirometry. And so that's a test where the patient will be, sitting and there's a tube they breathe into and out of, and it measures how well the patient is doing breathing air in and out of their lungs, and that's going to tell us whether or not they're having a tough time with the expiratory phase, with breathing air out. That's the definitive diagnosis. You can also, there's severity in airflow limitation, so that tells me what's going on in their airways, but actually the most important grading system to assess a patient is the GOLD grades A, B, or E. That tells us more about what's going on with the patient at that time and their risks in the future. And the things that this grading system takes into account is actually the level of a patient's dyspnea, so how short of breath they are. There's a few different scales we can measure. And you can think about it, somebody with shortness of breath only when they're going up a hill versus somebody who's short of breath and can't keep up with someone their own age. And then the other thing it looks at is exacerbations. So that's a worsening over a short period of time of those symptoms of cough, of sputum production, and of shortness of breath. And that's very important. They're in their own category. If you're having COPD exacerbations, that puts you at higher risk for complications and worsening of the disease. I think another big part of COPD, so you think about, of course, smoking cessation, and we think about inhalers and the airway, but it's also, a lot of studies have found, and it makes sense intuitively, that overall health is a big part. So these patients, you're much more at risk for things like lung infections. So getting, things like vaccines, so that you're not hit as hard by influenza or by pneumonia can really be a huge impact in your overall health. So I would really encourage that. The other thing that has been shown to be incredibly important in COPD is movement. There's actually a formal, I tell patients I'm prescribing them the gym. So pulmonary rehab is essentially, I'm sending them to the gym, but instead of sort of being on their own and lost in a sea of machines they don't understand, there was someone who understands that they have underlying lung disease and helps them slowly become more functional. So that includes some exercises to get them moving, as well as some weight training. And the goal is to get them functioning better in their day-to-day life so that they have less shortness of breath. I have patients who walk regularly and they start noticing the difference. So staying moving, ideally formal pulmonary rehab, but also just in your general life, doing a little bit of resistance, a little bit of walking can have a huge impact. I think progression is certainly, one thing. So if you notice that it's getting worse, we're not going away. You've had a cough for years and it's getting worse. Or, if you've had a cough for years, maybe just stop in and check. Coughing's not normal. I recognize a lot of people talk about the smoker's cough, but it's really those three symptoms for COPD: cough, mucus production, so if you're coughing up sputum, and shortness of breath. Those are the big three signs that suggest COPD, and so those are the big symptoms to look out for.